So much, Mrs. Oluwole, and thank you to NIE and the organizers of the Africa Digital Health Summit for inviting me to be your keynote. I think you can see the role of technology and how it's stretching all of us. So it's the great topic that we have today around how we can think about the role of technology and actually use it to help us accelerate progress towards our healthcare goals like universal healthcare coverage. You saw in the video how pregnancy and childbirth can be life-changing, life-defining experiences. This is the time where women are seeking care and interact with the healthcare system more frequently than usual. And for some women, it's for the very first time. These encounters provide a window of opportunity to deliver high-quality, respectful care that can establish long-term trust between the woman and her healthcare system. What happens during this relatively brief period can have an enormous impact on a woman's health, her life, her family, and her community. And improved maternal health investments in healthcare sets the foundation for women, children, and their communities, as well as societies, to thrive for generations to come. And we call this the mom effect. But unfortunately, the COVID-19 pandemic is undermining the mom effect. In their worst case scenario, a recent scientific publication estimated that COVID-19 could result in the deaths of over 1 million children and tens of thousands of mothers in just 6 months due to the significant reductions in the availability and the utilization of essential healthcare services caused by the pandemic. But we are already living in that worst case scenario, as many of you know. Last May, the Nigerian Ministry of Health reported that antenatal care visits and child immunization visits had dropped by about 50%. Skilled birth attendance had also dropped by 40%. Many of us, listening in on this conference may also remember the Ebola epidemic and remember how in those affected West African countries, Ebola wiped out 28 years of progress towards maternal health goals. We cannot afford for the same thing to happen again because of COVID-19. And we can't afford it to happen here in Nigeria, where we are not even starting from a place of strength. Nigeria has the highest number of estimated maternal deaths in the world. New mothers are dying in Nigeria, and they represent 23% of the global total. Think about that. Almost 1 in 4 of all the deaths happening in the world are happening in Nigeria. And so how do we make sure that our responses to the COVID-19 pandemic, in particular our responses regarding the role of technology, actually help us get closer to meeting our universal healthcare coverage goals and ending preventable maternal deaths across the globe? Because this is in fact what we have to do today. Before I share some of my thoughts on that, and I know many of you who are tuned in for all of the panels this afternoon will be listening to many of the other panelists and discussants also talk about this subject. I would like to share a story. The story is about Eniton. Eniton is not her real name, but she's a woman I met about 3 years ago during a visit to one of the public hospitals in Lagos State. It was the rainy season, and I remember we had to navigate through many flooded roads in order to join the hospital leadership who were giving the tour that day. And there I am, peeking into one of the wards, and I see a woman sitting in the middle of her hospital bed. And I was struck by how still she was, how fixed her gaze was on the wall in front of her. And each time I looked towards her, she was still in the exact same position, still gazing wide-eyed, straight ahead, not moving. And so I asked the matron in charge about her medical case, and she told me that she was pregnant. and she had been brought in the day before by family members because she was having seizures in her church. The medical team had been able to control her seizures, and she was diagnosed with eclampsia, a life-threatening condition that is one of the top causes of preventable maternal deaths. But the matron also told me that this was at least her third pregnancy, and she had lost her previous 2 pregnancies, and that she was at a very high risk of losing this one. She needed to be transferred to another hospital in order to get the level of care she needed. I asked matron if I could speak to her. And as I walked towards her hospital bed, I saw that she was clutching in her lap a phone, and she was holding onto it like it was a life preserver. I also saw that she looked scared, she looked alone, she looked like she didn't know what to do, but she also looked like she had, and she knew that she had no good options. I wasn't able to do or solve anything in that moment. And I also don't know for sure the end of her story. But I can predict that it probably did not end well. She likely ended up being a statistic, one of the 800 women who die every day due to preventable complications from pregnancy and childbirth. But what that moment taught me, and what it still leaves with me, is that we can all make a choice towards changing the story for future Anitons. We can all help to create a world where no woman has to die giving life. And that's the choice that MSD, also known as Merck in the US and Canada, made back in 2011 when it created MSD for Mothers, our company's $500 million commitment to helping end preventable maternal deaths worldwide. So when I think about this conversation that we are all tuned in to have, how do we accelerate achievement of universal healthcare coverage in the COVID era, and think about the role of technology? I am asking all of you to think about it through the eyes and through the lived experiences of Aniton. Could this story be any different because of technology? Could we design and deploy technology so we create a different outcome for her? Because if our thinking and our actions regarding the role of technology do not help her and thousands others like her, we would have failed. Because we know that technology is a means towards an end. It is not the end in and of itself. So it's great that we are all here today. And so let's think together about how technology may be able to help in saving Aniton's life and accelerating progress towards universal healthcare coverage. Some things I've been thinking about. What if Aniton's high blood pressure, one of the risk factors for developing that life-threatening preeclampsia and eclampsia, was diagnosed early on in her pregnancy? And through that phone that she was clutching in her hand, she was connected to healthcare coaches that supported her in managing her condition. In Nigeria, MSD for Mothers is collaborating with a number of organizations, JAPIGO, MDOC, and the Health Strategy and Delivery Foundation, to better identify and manage these types of risk factors throughout pregnancy, so that we can help reduce the likelihood of poor maternal health outcomes. And they are using technology to help do this. MDOC, an African-based social enterprise, is providing women in the program with the knowledge and self-care support via a digital platform called Complete Health that includes online coaches who offer virtual services. What about if through her phone, Aniton knew where to go to receive the level of high quality care she needed? MSD has also learned that from collaborations like we have in India, that when women use digital platforms to learn of each other's experiences and report on the level of quality care they receive, providers take notice and they work to improve the care that they give. In Nigeria, we're also collaborating with an organization called Omomi that is working to develop an easy-to-use rating system for quality maternity care. And the last, third thought I will leave you with is, what about if through her phone, Eniton had access to health insurance funds and ambulance services that supported her transfer to a different facility? In Kenya, MSD for Mothers is collaborating with the Farm Access Foundation to support the development of mom care, a care bundle designed specifically for expectant mothers. These mothers are enrolled into a partially subsidized health insurance program, and using this mobile platform that's on their phone, they can check in and pay at the clinic. And providers receive financial incentives for providing quality care at the end of a complete and successful healthcare journey. And during COVID, we also saw how mom care was able to link women to ambulance services so that they could be transferred to facilities during lockdown. Moses, one of the mom care project managers for Farm Access in Kenya, said that the goal of the mom care initiative is to ensure that more women experience safe deliveries. We all know women need to give birth even during the COVID pandemic and even during curfew hours. By facilitating access to an ambulance during curfew hours, we have been able to save mothers and children's lives. And so we all are seeing and we all are experiencing how the COVID-19 pandemic has highlighted that credible digital health resources and services are key to sustaining critical reproductive and maternal care services during this crisis, but also beyond. Despite the gendered inequalities around mobile ownership and internet access, adolescent girls and young women, even in low and middle income countries, are increasingly gaining access to internet-enabled phones. And mobile health interventions are becoming more common worldwide. A new study conducted by Women Deliver and Girl Effect in collaboration with MSD for Mothers finds that adolescent girls and young women in India, Malawi, Rwanda, they're all using digital platforms as one-stop shopping to find information about their bodies, their health, and their relationships. Close to 70% of the respondents suggested that they use technology to access information and advice, but also to identify a health practitioner. And most of them saw that they saw themselves using even more digital web-based technologies for health-related needs in the future. We are experiencing how COVID-19 is accelerating the pace of technology and innovations to provide quality healthcare remotely. And some of these innovations have the potential to break down barriers to accessing care beyond the immediate crisis of COVID-19. However, to realize the promise and the potential of technology to help us meet these long-term health goals, we must ensure that the innovations do not exacerbate already wide disparities in maternal health outcomes. We must be intentional about how to equitably accelerate the use of technology. These technologies must meet and reach and respond to the needs of Eniton. So how do we make sure that digital disruptions are deployed and scaled in an equitable way and in a way that does not bring harm to its users? One example I can give is through a partnership of MSD for Mothers with the World Bank Global Financing Facility, where in Myanmar, the GFF is developing a partnership with private companies in the telecom industry, not in health. And they're working to scale up these telehealth innovations to reach women and children in remote and conflict-affected areas including those women who are facing cultural, geographic, and financial barriers. And to find another example of how intentional approaches to supporting the deployment of technology can also be transformative of society, I just ask all of you, to look at one of the panel discussions later on this afternoon, the one on African women and digital health. We know that COVID is not just taking away lives, it is also taking away livelihoods. Africa is home to over 100 million informal micro and small enterprises that contribute to the 70% of the continent's employment. We also know that 70% of healthcare workers are women. What if our responses to COVID also catalyze social entrepreneurship? What if those responses created opportunities for employment, jump-started local economies, and advanced gender equality? I am so excited that the panel later today will highlight the critical contributions women are making in this space. Because ultimately, we recognize that the coronavirus pandemic will permanently change some aspects of the maternal health and wider health landscape, as it is already changing the way that we live and the way that we work. By providing critical investments for our health systems to keep women like Eniton, at the center of solutions, we can expand how quality of care can be provided and enable new technologies to reach everyone. We can make sure our health systems are more resilient for now, but also for the future. Technology allows us to meet women where they are, whether it's in their homes or on their phones. And COVID is teaching us that health systems do not end at the facility, they need to end with the person. We can learn from our COVID responses to build better patient-centered care. Finally, COVID is teaching us many hard truths. It has exposed societal fault lines around economic, gender, racial, and ethnic inequities. Our inability to deliver on essential services for the most vulnerable, marginalized, or disenfranchised is not just a reflection of the fragility of our current health systems. It's also a reflection of our societal values. Many of you listening in on this conference are not already only thinking about this, you are doing it. You are living it day in and day out. You are designing technology around the lives and lived experiences of people like Eniton. You are making a difference. Thank you.